Nursing assessment is a core part of how nurses care for patients. It means carefully gathering information about a person's health. Nurses look at the whole picture: body, mind, and emotions. This information helps nurses understand the patient's health problems and plan the best care. Imagine a detective solving a case. Nurses use their senses to observe, they ask questions to understand, and they use tools to get precise information. Just like a detective needs clues to solve a mystery, nurses need information to help patients get better. This process of gathering information isn't just done once. It continues throughout a patient's care. This ensures the care plan is always adapted to the patient's changing needs. It's a continuous cycle of assessing, planning, acting, and reassessing. There are different types of nursing assessments, each done at specific times and for specific purposes. Let's explore the four main types. Initial assessment. This thorough assessment happens when a patient first enters healthcare. It creates a baseline understanding of their health, including medical history, allergies, and current medications. This helps the medical team create an initial care plan. Focused assessment. This assessment zeroes in on a specific health concern. For example, if a patient complains of new chest pain, the nurse will focus on their heart and lungs, asking specific questions and performing targeted physical checks. Ongoing assessment. Health is not static, it changes constantly. Ongoing assessments involve regular checks throughout a patient's care. This could be as simple as monitoring vital signs or observing how a wound is healing. Emergency assessment. In urgent situations, quick thinking is crucial. Emergency assessments are rapid and focused, aiming to identify life-threatening problems and provide immediate care. For example, if a patient collapses, the nurse will quickly assess their airway, breathing, and circulation to provide life-saving interventions. Why are nursing assessments so important? Simply put, they are the foundation of good patient care. By carefully gathering information, nurses can identify health problems early. Early detection is key to successful treatment. Assessments help catch potential issues before they worsen. Plan individualized care. Every patient is unique. Assessments help nurses understand individual needs and preferences to create a personalized care plan. Track progress and adjust care. Health is not a straight line. Regular assessments help nurses monitor how patients respond to treatment and make adjustments as needed. Nursing assessments are not limited to specific times. They are woven throughout a patient's healthcare journey. On admission, when a patient enters a hospital or clinic, at the beginning of each shift, to establish a baseline for the day. Before, during, and after procedures or surgery, to monitor for any changes. When a patient's condition changes, to promptly address any new symptoms or concerns. Nurses use a combination of tools and techniques to gather information during assessments. Observation. This involves carefully watching the patient for any visual cues, such as skin color, breathing patterns, or body language. Interviewing. Asking questions is key to understanding a patient's perspective and experiences. This includes their medical history, lifestyle habits, and current symptoms. Physical examination. This hands-on approach involves listening to the heart and lungs, checking reflexes, and assessing for pain or discomfort. Vital signs monitoring. Regularly measuring temperature, pulse, blood pressure, and respiration rate provides crucial information about a patient's overall health status. Diagnostic tests. Nurses may order and interpret various tests such as blood work, urine analysis, or imaging scans to gain a deeper understanding of a patient's condition. In conclusion, nursing assessments are not just a routine task, they are a dynamic and essential process that underpins every aspect of patient care. By using a combination of observation, communication, and critical thinking, nurses can gather the information they need to provide safe, effective, and patient-centered care.